thank you all for spending a few moments with us today to give you an update on the current coronavirus situation in the city of Fort Wayne and the county of Allen. Although issues in our community and elsewhere are consistently changing, and our challenges are ever-changing, COVID-19 remains a serious public health threat to our community. So we thought it was important to provide you a status report for the public to hear from medical experts on what we're seeing and experiencing on a daily basis at the healthcare community, in the healthcare community, and throughout our entire citizenry. It's critical that all of us continue to use good judgment to help lessen the impact of this virus. We're grateful for the outstanding work that's being performed each day by our entire healthcare community. I'm also encouraged by the collective efforts of individuals, families, neighborhoods, and businesses who are working together to be considerate and patient during these difficult times. At this time, I would like to ask Allen County Commissioner Rich Beck to come forward. Rich?
Thank you, Mayor Henry. I would reiterate the Mayor's comments and thank you all for being here and tuning in today. Just a brief update. It's been a while since we've been together, and it's been a while that we've all been under the pandemic restrictions that we've had. But I think we're seeing progress. I think we're seeing that the governor's moved us to stage 4, which is positive. Stage 5 is right around the corner. And that's all because of the efforts you're putting forward and the practices of the guidance that's been put out there. The social distancing, washing your hands, the hand sanitizers, all those things really do matter, and it's important that we continue to follow that. Kind of a positive thing, I think we're trying to bring the economy back together, and that's extremely important. Put people back to work. We're seeing a lot of things change in government as well. The city and the county are working together collaboratively on many fronts, and one of the things we're trying to do is become more efficient at what we're doing. Our eyes have been opened during this pandemic. We're learning all kinds of things about what we could do better. So we're looking at our processes, we're looking at our delivery systems, and we're trying to figure out how we can be better serving our constituents. So there'll be more coming with that, but I wanted to let you know that we're taking advantage. We're looking at this as an opportunity to improve what we do in government and making it better as we come out of this situation. So keep that in mind. Welcome again. Thank you for your efforts, and do remember to wash your hands and social distance. Thank you very much.
Thank you, Commissioner. At this time, I'd like to ask Mindy Waldron from the Allen County Board of Health to address this issue as well. Mindy?
Thanks, Mayor. Well, good afternoon. My name is Mindy Waldron. I'm the administrator of the Allen County Health Department, and I thank you for the opportunity to provide a bit of an update, a little bit on some trends and where we're at this point. I do also want to thank all the elected officials in the room today, because this has been a long issue for the last 3 months, and to have supportive elected officials, which not all have, we're very blessed to have that, and I thank everybody for all of their support for our department. As we begin stage 4 in the governor's reopening plan, I think it would be good to talk a little bit about where we're at and where we're going. And today we received 19 newly reported cases of COVID-19, and yesterday we received 39 new cases. Yesterday we reported 4 new deaths, and so our current number is at 2,262 cases and 91 unfortunate deaths. In the last week, we've received a total of 264 new cases and have reported 9 deaths in that same time frame. And it does represent a bit of an increase, about a 16% increase over the week's time frame. But some of these numbers are to be slightly expected. We have more testing. Testing has been opened up without some of the restrictions. And the fact that people are more out and about is probably going to lead to more cases. It's about vigilance and how can we control that. So overall, I just want to ensure that we can keep those numbers at a steady or a manageable level over the coming months, or what will become a bit of a long haul, versus having spikes and outbreaks that'll make it difficult for our healthcare systems to handle. We do know that people have grown a bit tired of hearing our repetitive messaging, and I'm guessing all of us are going to reinforce the same tenets about being diligent with social distancing, wearing masks, increased vigilant with hand washing and hand sanitizing. But we can't stress enough the importance of all of those things as we attempt not to eliminate the cases that we'll have, because we know that's likely impossible, but more to control or continue to slow the spread. So I've heard people say that they'd rather be done with this illness, get back to life as usual, or statements about the validity of the disease fight. And I certainly understand where those feelings are coming from. I think we all do. And believe me, the I just want to be done with this darn COVID thing, I echo that myself, and so do our staff. However, the situation that we're in is not something that's likely to go away anytime soon. So it's about safety. So think about this as you consider how important the precautions are that we all continue to reinforce. I've heard the precautions for COVID sort of likened to all of the precautions you do to prevent deaths with auto vehicle accidents. In essence, a seatbelt alone reduces a good number of those deaths, much like the COVID precaution of socially distancing when you're out and about, keeping apart from others 6 feet. It's one factor, and it really does help reduce the spread. But when you couple the seatbelt and an airbag, the risk is even more, or the risk is lessened even more. And then when you throw in speed limits, training and driver's licenses, not driving under the influence, and adding everything all together, those cautionary steps together make the whole thing less likely to occur. And the same goes for all the COVID precautions that we talk about. Wearing masks, washing hands, covering your cough, keeping the distance, minimizing handshaking, hugging, all of the things that we would all like to do, and monitoring the symptoms daily and staying home if you develop those, which is a really key point. Those are the individual steps that when we do them together will help us fight this fight as we move through and wait for a deployable vaccine. We all did a good job of this in the early months, but we've grown weary, and in some cases we've grown a little lax. So we realize why, but we are asking, even though it's not fun or easy, that we do our best as individuals to provide that community fight. So our big tasks as a health department currently are readying for mass vaccinations in either the fall or next year, whenever we're ready to do that. Working with schools and businesses as they reopen and looking at plans, giving advice, working with them to do the safe measures that they can for their employees and our citizenry. And it will be a while until we are able to deploy that vaccine. So it's important that the public listens to all the things that we do continue to say and do their part as we weather this storm and stay safe in the meantime until we're ready. So thank you for that, and thank you.
Thank you, Mindy. We're very fortunate in the city of Fort Wayne and the county of Allen to have 3 great healthcare systems. Most cities our size don't have anywhere near that. So we're very blessed to be in that position. I've asked all 3 of them, Commissioner Beck and I have asked all 3 of them to come here today to give you their opinion and their counsel on how we should continue addressing this virus in our county. So first I'd like to ask Dr. Jason Rowe from Parkview Health.
Thank you, Mayor Henry and Commissioner Beck. So 3 brief points that I wanted to share with you today. And the first is that Parkview Health is seeing a rise not only in the number of cases, but also in the number of hospitalizations due to COVID-19. To the point that over the past 3 weeks or so, we've actually seen double the number of patients hospitalized for COVID-19 every day. In fact, those numbers are much higher than they were in the early days of the pandemic in March and April. And the timing of this sharp rise in hospitalization seems to correlate with the lifting of the stay-at-home order and some of the reopening that's been done. And so that leads me to believe that, to Mindy's point, as all of us really want to reestablish that sense of normalcy in our lives, that maybe we are not being as diligent as we could or should about masking and distancing and hand hygiene. The second point is that even though we're seeing a rise in hospitalizations, that we are still ready and safe, and we'll see you through this pandemic. So I would even venture to say that the clinics, the emergency departments, and the hospitals across this region are some of the very safest places that you can go in this region if you leave your home, because of the strict attention that we've given to distancing, masking, enhanced cleaning measures, and other precautions to help keep people safe. And finally, we're concerned for the health of the community, and it really is important to use good hand hygiene, soap and water, alcohol-based hand sanitizer, frequently, but in particular before you touch your eyes, nose, and mouth, social distancing, 6 feet or more, and especially masking. So to spend just a moment on masking, there have been a few recent papers that have hit the medical journals and the media that really speak to the importance of masking, perhaps even more so than distancing or stay-at-home orders, in curbing the spread of the disease and bringing an end to the pandemic until a vaccine is available. I just want to clear up a quick misconception about mask wearing that I often hear from friends or neighbors in the community. So I hear people say, I don't need to wear a mask because I'm low risk. I don't have lung disease, diabetes, heart disease, hypertension. I'm not 65 years old. Or I'll hear people say, I'm not afraid of the virus. Bring it on. I'm not going to wear a mask. The message I want to drive home is that when I wear a mask, a cloth face covering, this is not to protect me. I wear a mask to protect you. So we know that the virus is spread mainly through respiratory droplets. When I speak, sing, cough, sneeze, respiratory droplets leave my mouth and go 3 to 6 feet or more in front of me. And if I'm wearing a mask, that helps to contain those respiratory droplets, which may contain virus particles, even if I don't have symptoms of COVID-19 infection. And so really, when I wear a mask, it's not to say I'm afraid or I'm not strong enough. When I wear a mask, what it should tell you is that I care enough about you that I'm willing to put up with the discomfort and the social stigma of wearing a mask. So I would encourage everyone to wear a mask when you leave your home and go into public.
Thank you, Dr. Rowe. We've also asked Lutheran system to come forward to say a few words as well. The speaker today is Dr. Bhatia. Doctor?
Thank you, Mayor Henry and Commissioner Beck. So again, I just want to reiterate what my colleague has said, Dr. Rowe. As we've seen a slight uptick, not as much as Parkview Health, in the number of cases in the community and our hospitalizations. And the way we see it, and as you know it, I think in the foreseeable future, COVID-19 is here to stay. So as we go forward, all our plans are based on not to have a COVID-free future, but a COVID-safe present, right? To that, we make every effort to provide safe and appropriate care for the community. So as we work through it, I think our focus is right now to continue the care that is much needed in the community. It is not only urgent and emergent cares, but also the continuity of chronic medical conditions. And our all effort right now is not to only provide appropriate needed care for the COVID-19 patients that present to the hospital, but to maintain that the care is needed and ongoing needs, because we don't want chronic health conditions to escalate. And so far, we've seen that the community has come together, really, and we never saw the surge in this community because early measures put in place by the county, by the Department of Health, and by everyone that resides in Allen County. And we know what they were. They were social distancing. They were maintaining a distance of 6 feet apart, wearing masks, wash our hands like our parents taught us early childhood. And that has what had helped us to prevent that surge. And since we started reopening, rightfully so, we have to maintain and we have to reopen based on everything that's going on in the community and the need of the community. So we have seen an uptick, and we really want to continue to drive home the message, like my colleague said, continue to wear the mask. The mask does prevent It does prevent you getting infected, but more so it prevents others around you getting infected. Like we said, the elderly, the immunocompromised, the people who have comorbid conditions need to stay home. But the younger people who are out and about in the community, if they don't wear the mask, they can contact the disease. They can bring it home to their loved ones. And if they take appropriate measures, you prevent the spread in the community. And the message is still supply and demand, right? I mean, so our healthcare systems can take care of the patients till the intake of hospitalizations and the spread in the community is slow. If we don't take the measures that we have been taking, like same thing, hand hygiene, social distancing, keeping your distance, and masking, we can see that supply escalate very quickly. The demand escalate very quickly, and we can come to a point we cannot match the supply to that. So again, there's only one message: we need to continue to do what we have done so well. That helps us take care of everyone in the community. And the other is, do not disregard your symptoms of heart attacks, strokes, your healthcare needs, because I think we don't want them to escalate. We want you to call your physicians. We want you to take care of chronic medical conditions. We want you to present all the efforts that the healthcare systems and we at Lutheran have taken are to provide safe care to the patients. Again, if there's a safe zone in the community, we would say that's our hospital systems. So thank you for giving us the opportunity.
Thank you, Doctor. Finally, IU Health is a newcomer to our community, but has taken a very aggressive approach, is trying to meet some of the healthcare needs of our community. And today, representing IU Health is Dr. Randolph. Doctor?
Well, I hope you've all noticed how all of us on the medical side are wearing our masks, and I'm even reluctant to take it off at this podium, but since we're a good 6 feet, I feel comfortable with that. I really do believe that it is probably the most important measure of all of the measures that have been addressed here. I do want to bring you up to date on what we are doing with IU Health statewide. I can afford you the opportunity to have a little bit of that perspective. In our 16 hospitals throughout the state, the number of admissions for COVID-19 have been steady. They have not increased during this interval as it has at Parkview, but it has been steady. In other words, it's not declined significantly. The number of cases that we're diagnosing have increased. Those patients are not necessarily being hospitalized, but the disease continues to be present in all of our communities throughout the state in which IU Health has a presence. We have begun to restore activity in our hospitals and in our ambulatory clinics. We've begun doing elective surgery again. I know that in the other health systems in town that has begun as well. And we've begun to use our hospitals and our health facilities throughout the state in ways that we did prior with seeing patients in person. One residual effect of this whole process is that we are now doing more virtual medicine than we have ever done. I think we're learning what works virtually and what doesn't work virtually, and what our doctors are feeding back to us about what they believe is useful in terms of telemedicine functionality. So some of that is being learned, and that's being conveyed to our schedulers, and the schedulers have a concept of what kinds of visits are best done still virtually and which kinds of visits are best done in person. Understand, as you've heard Dr. Bhatia and Dr. Rowe describe, that all of us have worked very hard to make our facilities safe for you. All of our staff are wearing masks. All of our staff are treating every room after a patient's been seen to sterilize that room and to make sure that it's thoroughly cleaned with appropriate cleansers. And we're doing all of the things that we can to make sure that you have an opportunity to be distanced in our lobbies. If you have to wait, in most situations you'll never have to wait to be seen. We'll get you in a room right away. So those chronic conditions and acute conditions that you want to be seen for, you should be seen for. Don't defer those. We have done that up to now. We're asking you not to do that anymore. We think we can do a better job of getting your health back on track the sooner that we see you. So the last thing I want to make a comment about, and I'm not going to reiterate about all of the steps that we've talked about already, but what I do want to do is make it clear of the why we're doing this, why we really believe that keeping the numbers of cases down that we see abruptly helps all of us collectively as a community. And what that means is it gives our scientists an opportunity to develop medications and decide what medications are effective. It gives our scientists a chance to develop and test and make sure that vaccines are appropriate and that they are going to be actually useful to us when they are brought out. That time span is still a several months time span. And so between now and then, if we can prevent surges, we diminish the lethality of this disease. COVID-19 becomes lethal, most lethal, when our systems are overpressed. You've seen it in New York, you've seen it in New Orleans, and you've seen it in multiple places throughout the world. When people come too fast, it's hard for us to make the appropriate adjustments to be able to take care of them effectively. So understand that these measures have a reason. There are good reasons why we really need you to be helpful to us over the course of the next several months to try and diminish the rate of spread of the disease. Thanks very much.
Doctor, thank you. In fact, I would like to thank all three systems for sending representatives today to inform the city of Fort Wayne and the county of Allen what the current situation is in our respective communities. I also want to thank the Board of Health and obviously Commissioner Beck. Before I came here this morning, I was asked, why are you giving another update? Everything's opening up. Within a few weeks, we'll be at stage 5, the governor's plan, and everything is open. Well, it was just 2 or 3 weeks ago, we celebrated Memorial Day. Since that time, almost half the states of this country have experienced significant increases in COVID-19. Most of them are on the coastal states, where beaches were opened, where boardwalks were opened, where amusement parks were opened. Social distancing, for the most part, did not exist. And as a result, significant increases in the coronavirus environment have taken place. That's why we're here today. It has not moved as significant to the Midwest as it has been elsewhere, but that does not lessen the seriousness of the situation. That's, again, why these physicians, why Mindy Waldron and Rich Beck are here to remind all of us that coronavirus is still among us. It's a very serious situation until such time as a vaccine comes forth where it can be mass produced and mass distributed. We need to take those kinds of precautions. So with that, I'd like to thank you all again for coming today. If there's any questions from the media now, fine. If not, I'm sure everyone will be available for individual interviews.
Mayor Henry, are you considering at all a mandatory wearing of the mask in public that's been done in other parts of the region and state of the country?
Some cities have chosen to have mandatory mask wearing. So far, we have decided that probably is not in the best interest of our community, that we're asking people to voluntarily wear them, again, under the current environment. I think I'm still correct on all of that.
This is a question for any of the health department or the hospital officials. At what point do we reach critical mass and say, we've got to start rolling back some of the things we've rolled out?
Doctor? Thank you.
So thanks for the question. I can certainly speak for Parkview Health, and we still have an active incident command center that is constantly monitoring both the activity of the virus in the community, the number of hospitalizations that we have, along with the plan to fully reopen. And so these two plans, the surge plan and the plan to fully reopen, are closely dovetailed, and our incident command center is helping to regulate. Many of the things that we've opened up now will not impact our ability to continue to care for as many hospitalized patients as we need to. So things like elective surgeries, we've been able to resume in a way that should not adversely affect our ability to care for COVID inpatients. But it is something we continue to closely monitor.
I have a question for any of the healthcare professionals. Do you believe that, or have you seen an increase just since the reopening, or do you believe that the protests may have contributed to that as well, as far as people being out, screaming, being in close proximity? What are your thoughts of that as well?
Go ahead, Vishal.
Yeah, we initially saw the spike actually after the reopening, right? And the cases in the community have gone up, and I think the health systems have looked at different rates of hospitalization over the period. But as far as Lutheran Health Network goes, we saw an initial spike around, and it peaked around the 18th. And since then, our hospitalizations have been very consistent. So they've remained stable since then. Again, that does not diminish the need for social distancing and wearing a mask, okay?
With hospitalizations now, are we anywhere near the highest point of hospitalizations that we've seen, or where is that concern been?
So we have, as a system, have not seen the highest point yet, but you have to see that we initially started when we did see the initial surge of patients. There were a lot of unidentified patients which could come with similar symptoms, but since the advent of rapid testing, we have a couple of types of tests that we can immediately get the results within 45 minutes to 60 minutes. With the advent of that, we've seen, because those unidentified patients have gone away, so we really have the COVID-19 patients that we have created COVID-19 zones with dedicated staff to look after. So we've seen the burden on the health system go down significantly since the start. And again, we are very well prepared right now, because initially we were still looking at what we need to do, what things need to be in place, what are we going to treat the patients with, the ventilators. So, but now we are adequately prepared that the initial count, we are well prepared to look after the patients that we have.
So have we seen the peak? Your guess is as good as mine. I think it really depends upon whether the public takes seriously the recommendations around masking and distancing and hand hygiene. And to the earlier question, the timing really correlates, this timing in this surge that we're seeing in our hospital capacity really correlates with the reopening and with Memorial Day. So what we know about the virus is that after you contract it, you may have a period of a week, give or take, where you're symptom-free but infected. And then once you develop symptoms, it takes about a week to be sick enough to become hospitalized. So to see a lag of 2.5 weeks between, for example, the reopening and the beginning of our inpatient surge is not at all surprising, and I think it shows good correlation between those two things.
I have a question for Dr. Randolph. You had mentioned that your facilities across the state have seen a steady number of cases or hospitalizations. That's not the question. I just want to be clear about.
The hospitalization numbers have declined slightly.
Okay.
Total number of cases has remained steady. New cases every day, we see roughly the same number of new cases every day in almost all of our markets.
So that's obviously the goal is to flatten the curve. That's what we've been talking about since day one.
Absolutely.
And seeing steady case numbers, while good, is not necessarily that great. Does that speak to the fact that anything is getting worse, or just the prevalence of the disease in the community?
A little of both. Plus, I think it was talked about earlier is we're testing more people now. People who previously didn't have access to a test, we now test them. So, and I'm very happy about that. All of us are. The more information that we have in terms of the actual diagnosis of the disease is going to really help us understand better how to manage it. So, did that answer your question?
Yeah.
Thank you.
We're going to have to stop the formal press conference now. We have another meeting coming in. But obviously, as I said a few minutes ago, I'm sure the healthcare professionals, Mindy and Commissioner Beck, are all available for individual interviews. Thank you all so much for coming.